Hi, everybody. This is Kara Thrasher Livingston with Senior and Disability Services, and you're in the right place if you are looking for our long-term care authorizations and PASRR webinar updates. We're just going to take a couple minutes in the very beginning of our session here to talk about how to get the best out of the webinar. And many of you have probably been in a webinar with us before, but just a couple of reminders. We'll talk about the audio first. For audio, you could have joined us by telephone, or perhaps you're listening on your computer. Either one is perfectly fine. By phone, the system GoToWebinar assigns kind of a random long-distance number. Sometimes people notice that it's not an Alaskan number, but rest assured, we're broadcasting to you live from Anchorage, Alaska, on the phone here. And so that's, if you lose audio by chance, you can always click out of the webinar and come back in using the same link. It's relatively common maybe to lose audio. You may also notice that it's hard to hear us, or our audio kind of gets sped up or slowed down. So I do want to practice to see if you can hear me okay right now. If you look at your webinar controls, you'll see a little circle with a hand in the middle, a little icon of a hand. That is how you raise your hand, and we might ask you to respond to us using the hand. So if you could find that little hand and raise your hand for us right now, I want to make sure that you can hear me okay. If you can hear me, go ahead and raise the hand. Okay, awesome. Many of you are very fast at raising the hand. In a minute, I'll just read out the names of folks who I have in my webinar right now. I'll go ahead and I'll lower the hands, and if you just raised it and just saw that I lowered it, don't worry. Our computers kind of run on different speeds, so that's perfectly fine. So let's talk about the visual. You can see my my webinar display, the first slide of our PowerPoint here. You can also see, of course, the little icon with the hand. You can see a little picture of a camera. The camera will take a picture of the screen. That is not necessary because, you might get a lot of picture files on your device, whatever that may be. We can also offer a copy of the display, the PowerPoint presentation, after we're done. We're also doing a recording of it so we can offer it to you on our YouTube channel, or to your colleagues who wanted to make it but weren't available right now. Okay, I'll take a quick, I'll make a quick listing of who is in our session right now. I have Hope, Janet, Judy, Kirsten, Marianne, Melissa, Nancy, and Tammy and Tara. I have duplicate names for Tammy and Tara, so if you have other people who also have C. Manson, if you have other folks who are in the session by a shared link, that's okay. You'll have to find the question box and type in your name if you want to sign in. So also next to your webinar, you'll see a little bar usually, or a box, or an arrow that says question. You can click on that and open up a question area, and you could type anything you like to us in there. That would be for your questions or comments or concerns or anything. So if you could just open that up and practice for me. If I didn't call your name, go ahead and let us know who you are. Sign in like that. If I did call your name, just go ahead and write hello, or tell us how the weather is where you are, and we'll watch our question box. Can you locate the questions for texting to us? I'll give you a second to try. Okay, awesome. Melissa says it's rainy and snowy in Juneau. Right on. Kirsten says hello. And sometimes our computers run at different speeds, so your answers may be coming in. We just didn't see them yet. Go ahead and locate that question box if you can for me, and just write hi, or let us know how the weather is where you are. Okay. Hi, Deb. Hi, Hope. Raining in Ketchikan. Hi, Marianne. Sunny and warm for you, Tara. Judy says, I found it. Nah, just kidding, Tara. Okay. Yeah. You just look for an arrow, and it'll open up a question area there. Okay. Looks like everybody's good. We will also be able to perhaps type answers into you. I do have a group of presenters here with me, So I would like to let our wonderful presenters introduce themselves at this time, and then we'll start our presentation. Go ahead.
Hi, this is Molly Atanoa. Hello, everybody.
This is Scott Chow. I'm one of the nurses that recently started working with long-term care.
Hi, this is Keith Masker. I'm the reviewer.
It's Maria right now. Christina Johannes, who does the level of care decisions with Scott.
Okay, awesome. So just let me know when you want me to advance the slide, and I'll go for it. This is Kara, okay?
Great. All right. Well, hello, everybody. It's Molly. I'll start us off, and we'll start to pass it around to Keith and maybe even the others to chime in as we go through our slides. So it's been at least 2 years since we had our last quarterly webinar, up until today, of course. So we're thankful that we're able to revive these webinars, as we found them to be very beneficial in the past. We unfortunately were not able to resume our quarterly webinars for a while, but we are now, and so we're thankful we have this opportunity again. We plan to continue these quarterly webinars, and we may also have another one sooner than our quarterly schedule as we continue to enable more functionality in the Harmony system for facilities. So be on the lookout for those invites. We can go on to the next slide. Thank you. Our agenda today, or what we wanted to cover today, we wanted to briefly look at some of the SDS updates, of which you may already be aware. We wanted to take a look at what we're seeing coming in, authorizations and PASRRs that we're processing, and also take a look at, more importantly, some of the reasons why we may be sending them back to you to be completed or to provide additional information. We have a couple of reminders we'd like to review with you as well. We have some Harmony updates. We wanted to take a look at what we're working on to further simplify our processes, and we've heard some feedback, and we want to start implementing some of those efficiencies. So, and then we also wanted to start to introduce some of the things we're able to do now in Harmony. Okay, next slide. But before we start, we would like to take this opportunity to say thank you to all of you, facilities, hospitals, nursing homes. We're aware that the last couple of years hasn't been easy for you all, and we want to acknowledge that. While it hasn't been easy, you have all continued to work well with us. You have been patient and understanding. You all have been professional and considerate through it all. So we are also seeing that you're also sending us some kudos via email, and we appreciate and are grateful for that. We as well share the same feeling, and so we wanted to acknowledge that first and foremost today. So thank you, thank you, thank you. Next slide. So what's new at SDS? As you may all know, or maybe not, our new division director is John Lee. I know he's been a part of ASHNA, and you probably know him better than I with all of his work with ASHNA and long-term care facilities out there. We're happy and are looking forward to working with him in this capacity. Our current acting deputy director, Lynn Kyleman Cruz, who's been with the division for quite some time, she is our current in acting. She's in the pink in the picture you see. She'll probably kill me for this, but you know, she's a bike to work wellness warrior, and so I thought that was the most befitting of pictures. Next slide, please. We have implemented a restructure. We've talked about that a little bit in before. Our previous CAT intake and assessment unit was a pretty large unit that we have transitioned into 3 smaller units. And one of those units now is our new nursing unit. It has been separated out from the other 2 units, and there is no longer a CAT intake and assessment unit that used to house many more division responsibilities. The new nursing unit is now primarily responsible for the oversight of our long-term care authorization and PASRR body of work. And of course, there you have the team. We're all here today. So some names to some faces. Next slide, please. We wanted to take a look at our long-term care authorizations and PASRRs and what we're seeing coming into the division. We want to continue to, if you remember from our previous quarterly webinars, we tried to keep an eye on the numbers, what we're seeing, track that better to look at some of what's trending and have that drive some of our some of the work that we need to address and look at making some changes too. So to better serve the community, we wanted to take a look at our next slide, please. So our time frame is October 1 to December 31 of 2019. And we've been able to create a report to look at what's coming in or what gets submitted. So you'll see in that 3-month time, we have received and processed 1,023 PASRRs and or long-term care authorization requests, be it level of care changes, initial nursing home admissions, reauthorizations, retros, and swing beds. Individually, you'll see to the far right of your screen is the count to some of that, to each of those note subtypes. If you're in Harmony, you'll notice that is the note subtype to use. So tracking some of this information in our system. Next slide, please. So you'll see our initials or the initial nursing home admissions or PASRR level 1 screenings are the most of what we receive, followed by reauthorizations, followed by our PASRR level 1 screenings for non-Medicaid residents or patients. Next screen, please, or next slide. In blue, you'll see those are our numbers of what we actually received that you've submitted. And in red is what we have received incomplete, or we've had to send back for corrections or information that might be missing. So you'll see, especially with our PASRR initials, we're almost at about 1/3 of what we receive is identified as incomplete. And so we're sending those back to facilities for corrections. Whether we receive the authorizations via email or via Harmony, we are working to better track these and to look specifically at what are the common reasons for returning these submissions. Okay, next slide, please. And what we're seeing to account for 90% of all the incomplete forms are usually blank fields, missing pages, unmarked boxes, or boxes that might have NA in them rather than a response to a question or information. Yeah, we're seeing that is majority of the reason why we would send something back. Next slide, please. a lot of what we're seeing, where we're seeing that incomplete information is in our demographics section. Demographic information on both PASRRs and long-term care authorization forms. Either the long-term care authorization form is submitted without a PASRR, or a PASRR is submitted without a long-term care auth form when Medicaid is indicated, name is missing or wrong, or a nickname is used. We'd like to see full names spelled correctly. Date of birth is usually incorrect. The year is entered as the current year. Medicaid number is usually short a digit or two, a number or two. Incomplete address. A lot of what we're seeing is only the city is provided, and we don't have a, sorry, we have a message on the screen.
Oh, okay. That's okay.
Incomplete addresses. In our Alaska Native American Indian section is incomplete. We're looking that if you do say yes there, provide the physician name and the tribal health organization information. So we'll start with the PASRR form and look at some of the missing sections there. Next slide, please. And here's where Keith is going to lead us through some of what he sees most commonly as missing. Keith, go ahead.
Okay, so on the first page of PASRR, there's a section labeled applicant or resident. The applicant section is usually for the initials, and the resident section is for the reauthorizations. And on the PASRR form, towards the middle bottom part of the PASRR form on the first page, either the applicant section or the resident section needs to be completed, depending upon if it's an initial or a resident review.
Resident review.
Mark 1, categorical determination, please. There are follow-up things that we have to do on our end. So marking multiple categorical determinations is usually not going to work. They start there at the bottom of the PASRR page, and they continue at the top of the second page of the PASRR form. Next slide, please. We need the diagnosis paired off with the ICD-10 codes. The name or the diagnosis needs to match the ICD-10 code, and please enter the date of onset. When you move further down in this section, there's the yes or no boxes. We need each of those sets of yes and no boxes marked, and please only mark either the yes or the no box. I've actually seen a lot of these filled out with every box marked. Now this is really important here on the PASRR. We'll get the signature and we'll get the date of the physician's signature. However, what we won't get is the physician's full name or credentials. What we have had in the past is just the last name with Dr. Smith. Unfortunately, there's a lot of doctors in Alaska, and pinpointing who that is a little bit difficult. The other part to that is when we looked up somebody's name that was labeled doctor, they were actually an A&P. So we need to see MD or DO, please. Next slide. So, can I get the next slide? Oh, I went on, sorry.
Okay.
Yeah.
Okay.
Can we get the next slide after this?
Yeah.
I think I already went over that. So for check all that were required, the H&P needs to be marked on all the PASRRs. But-
Hang on one second.
Oh.
This is the LTC form.
Yeah, it's like we're off one.
To go.
I think
Go
that's
back.
previous.
Sorry.
Of course.
Here we
Oh,
go.
yeah, sorry.
That's all right.
The H&P section needs to be marked. It's required for every PASRR form. And please check any of the other boxes that apply. The next section, we need the person's full name and credentials that were utilized or that created the PASRR form. And the date that you signed it and your telephone number. This way we can get back to you. And of course, please sign the form. Next slide, please.
Yeah. Sometimes some of those questions are pretty minor and simple. We don't want to send the PASRR back to you if it's really something we could easily call you and ask you quickly rather than, you know, return a submission altogether for something simple we could just call and ask you about and clarify. So that contact information is important. We want to be able to easily call you and get you directly. All right, on to our long-term care authorization form.
Okay, and again, a lot of this is going to be duplicative of the PASRR form because they do share a lot of the information. But it is important to fill out both PASRR form and the long-term care form with the duplicative information, because if we only see one or the other, especially in the case of swing beds and AWDs, we're not going to see a PASRR form. So again, full names, please fill out the difference between the PASRR form and the long-term care form is, of course, the Alaska Native American Indian section. Does the referring provider work for the tribal health organization? And of course, the referring provider's name, which is the physician that is signing off on the patient to admit. And of course, there's the applicant section for initials, and there's the resident section for reauthorizations. Next page. Okay, so for current location, for the initials, we're looking for where the person is. Of course, the reauthorization, this is just going to be continuation of where the person is. The placement category is very important when you're working with a facility to admit them into a hospital. A lot of facilities have multiple numbers, so the placement category needs to match the ID number for the facility. Placement or payment source, I see this blank a lot. Recommended level of care. Please only mark one of these boxes, and this should match the physician's recommended level of care on page 3 of the LTC form. And of course, there's the proposed actual admission date and the requested period of coverage. Next slide. On the website, we have our forms, and a lot of the forms have, there's a couple sections where they have auto-populated information. One of these sections is the name of proposed admitting facility and ID. What happens is this auto-populates at the top for the admitting facility and ID number. If you put down the ID number first, it'll show up on every single page thereafter. So if you can, please remember to put the ID number first, because if we were to put down our ID in State of Alaska, Senior Disability Services, what happens is the ID shows up and then the name is cut off on the pages that follow. And of course, for the administrative wait day beds, we ask that you check that box next to if new admission, The reason why is because this is where you're looking for other placements, and we do require that even though you've submitted an AWD request, that another long-term care form be completed requesting the long-term care placement as well. Next slide, please. So the name of the representative has only first or last name, or NA address is missing, full name is required, or self is acceptable. Basically, this is the representative for the patient section. If the patient requires an alternative representative, this is the spot where you would put it, or you just duplicate the patient's demographic information in this area if the patient is their own representative. SDS must have a medical decision maker identified here. All right, next slide. Okay, again, please pair off the diagnosis with the ICD-10 codes and make sure that they match. Another reason that and I don't know why, but another reason for a lot of kickbacks is the medical reason section in this section is not filled out. Please list the medical reason for admission and not just a diagnosis. This is also the page where the physician puts down the recommended level of care. Please make sure that the recommended level of care matches on the first page of the LTC form. The certification of intended length of stay, please mark only one box in this section. Next slide, please. And here, please provide the physician orders as indicated. We're requiring the physician's orders instead of signing off on the LTC form. Also, the medications, if you're submitting this through Harmony, there's going to be a list of medications available to select. If you can't locate the medication that you're trying to upload, please list other and then enter the name in the diagnosis field
And the dosage.
In the dosage field with the dosage amount.
Yeah, so some history behind this section. You know, our previous form always required a doctor to sign, and you know, after going through some form changes, we heard the feedback about the challenge of trying to find a doctor to sign this section. We took the requirement for a signature away, but I'll tell you, we still see quite a consistent number of authorizations that come in and continue to be signed by doctors. Though the line is not provided, we see both. So some feedback that might be nice, you know, as we look at updating our form, you know, send us an email, let me know whether it's easier to have the doctor sign this section, or should we continue with just requiring you attach the order, especially for reauthorizations. But it was removed after our last form update. So be thinking about that and let us know what you would like to see as far as future form updates should look like.
And this is Kara. There's a question. It says, can you elaborate on the physician orders?
So to be admitted to a nursing home, it has to be ordered by a physician. And so we require a doctor's order, whether it's a new admission to the facility or a continued stay in the facility, we require a doctor's order for both. Okay, if you have further questions on that, feel free to email me. We can talk about any specifics there.
There's a comment says, so for acute, we do not have the orders until this is approved. That is usually why we have it signed.
So once we see the form coming in, we look at your HNP, and we're looking at some of the documents you present so we can see what the assessment and plan might be. So if the discharge disposition from the acute care plan indicates, admit to long-term care, that's what starts us off. We see that information is there. We may not see individual orders that might indicate, start PT or OT or those types of things. We're seeing that in the actual documentation. So not to say that what's required is a doctor, listing out all the things that are needed. We're actually seeing that in sometimes the HNP, sometimes in some of the documentation that's submitted with the long-term care authorization form.
Question says, can we have the ND sign instead of getting orders?
You can have if it's a reauthorization, what we're finding challenging is we may see an MD sign this section, but we're not seeing what the MD wants the nursing home to focus on or to follow. So if we're seeing things like, there's a continued need for nursing, and that's what the doctor is ordering, nursing specifically for what things. If we're not able to see it based on the documentation provided, then we'll ask. Sometimes we'll see the signature here, but we don't have documentation of what's being done. So we don't know. Some facilities will submit a doctor's order that says certified to continue to meet ICF level of care. So what we're looking for is what are we monitoring? What are we having the nurses do, or the skilled professional? What are we having them do? What does the doctor want them to focus on? So again, some things are a little more apparent in the documentation, and some are not. So you'll see us asking for more information if we are not seeing the information we would need. But again, you'll probably get a call from Christina or Scott identifying what it is we're not seeing, or what might be missing that maybe it was just an oversight on our part. So
okay. So in the cognition section, we ask that you check either the okay or problem section, or the boxes. And then if it's a problem, we ask that you explain. Please provide therapy records to support what is identified below: physical therapy, occupational therapy, speech therapy, or other. And again, in the check all that are attached, please check the H&P. It is required for all the LTC forms. And please check any of the other boxes that apply.
All right. That concludes our list of commonly seen missing information, or some common reasons why we would send some of these submissions back to you. We try to address some of the minor things so we don't have to send them back, but sometimes there's a need for more information that we're just not seeing. So that leads us into our reminders section, and we just wanted to, again, looking back at our policy that we had put in place several years back. We were seeing some problems with issuing approved authorizations for admissions, initial admissions. We would provide the approved authorization with a segment number, and then we find out later the admit date that we were reporting to Conduent for billing purposes didn't match, or the dates of services didn't quite match, and so a lot of those get kicked back. We also saw that some of those authorizations never actualized an admission to the nursing home, and so we had open authorizations or segments for billing that were sitting open with Conduent. That resulted in some other claims being denied on that end. So we started asking that, or we started to implement this process where we would provide an approved authorization without a segment number. And we asked that the admitting facility would send us an email and let us know when the patient actually admitted. And once we have that actual admission date, we would then issue the segment control number, and the start date or the admission date that we would then send to Conduent for billing and claims would match. So there's less of a denial or rejected claim based on dates. And we wouldn't have unnecessary open segments sitting there that never truly actualized to a true nursing home admission. So from that, we decided, okay, we would try something different here, and we've seen this work well in the last, since we started it. There's still a bit of confusion about it, and so we just wanted to bring this forward again. You will see that any initial admission authorization will be approved and returned to the facility or the hospital without a segment control number. The admitting facility should email DSM email us at the address provided. We'd like to see that in the subject line you indicate segment request for your resident or your patient. In the body of the email, we'd like to see that there's a date of birth, which facility, which nursing home the person was admitted to, and the date of admission. We would also ask that you provide us a copy of the approved authorization that was sent to you. If the facility is in harmony and you have provisioned users, you may get a response to your email asking you to check your notes notification. As we provide the segment control number, we are making that edit to the authorization. We're creating the note and uploading that authorization to the note. So we'll send you a response to the email letting you know the authorization with the segment number assigned to it, is now in harmony. You can see it, you have access to it, and that's where you'll know the segment authorization lives. All right, next slide, please. Our discharges and deaths are information that we ask of the facilities, as well as admission dates. If a resident discharges or a resident passes on, we ask that you let us know. And that option is available for you to use in Harmony. You'll see the note type. I have a snippet of it there. As the facility, the program is LTC facility. The note type is consumer communication external. The note subtype is discharge disenrollment. And then you can indicate, the example is in the note, discharged from, the nursing home and the discharge date. Your note status is submitted, and then when you just save and close, not close and save and close your note, that will send us a tickler letting us know that we have communication from you. that is one way to do it. For those of you in Harmony, we ask that you use this way. Next slide, please. And for those of you who are not in Harmony, you can continue to send us the DSM email to let us know. We ask that the subject line, of course, indicate discharge or deceased, name of the resident in the body, discharged from the nursing home or the facility, and the date. And then in the signature line, we ask that you provide your full name, credentials, and the facility name. Sometimes we can't quite tell from the email address what facility you are from. Provided an example there for you. Next slide, please. Some Harmony updates. We see that 95% of nursing homes are in Harmony and are and have multiple provisioned users in Harmony. We're working with the remaining facilities to try and get them in. We ask that you continue to use Harmony. The feedback we're getting is that it is beneficial. It's less time-consuming on our end as well. And of course, if there are any questions, just give us a call. We'll help to guide you through. What we are working on is updating our training guide. There's information we need to update in our training guide. And once we're done, we look to get that out to you probably the second week of April. We are looking to start some different things, like, we want to start having you submit your retroactive requests. Now retroactive requests are what we are working on now. You have that capability now. We'll go through that here in the next slide. But we wanted to start with retroactive requests followed by swing beds. Start using Harmony to report deaths and discharges, and what's coming soon will be the ability to request segment numbers or segment control numbers. Some of you know it as. So retroactive submitted requests. Next slide, please. Of course, only if you are a Harmony user. Right now, it's the same process as if you're submitting a reauthorization. It's only available to those facilities who are actual hospitals, I guess, that has the long-term side of the hospital as well as swing beds. So you are in as a nursing home because you would be submitting reauthorizations, but at the same time, you are sending us DSM emails because we have not started to accept initial long-term care authorizations. So we're starting here with the retroactive requests. And as mentioned, we will move to swing beds next. Not all hospitals are in Harmony at this time. It's only some of these rural hospitals that have both a long-term and acute side. So as you see the note, we ask that you follow the same steps as your reauthorization, as if you were submitting a reauthorization. The note subtype would be retroactive submitted. And same note status, you set it to submitted, and then save and close, and that will send us a tickler. That lets us know a request has been submitted to us. Okay, next slide, please. And when you're filling out the form, the LTC Authorization External Form, in Harmony, the selection of applicant, you will see retroactive Medicaid, as you would select that as the option to choose. And this is your form type. So once it gets sent in to us, we'll see that it's a retroactive request. and not a reauthorization. Of course, it's a new process, so I'm sure we'll have to work out some wrinkles here and there, but please call us if you have any questions. We will help to walk you through it. Okay, next slide, please. Okay, and that brings us to the end of our PowerPoint. So if you have any further questions, comments, concerns, we are all ears, and we can answer what we can answer now. We can look into questions we are not able to answer now, and we'll definitely take some feedback.
So this is Kara. Go ahead and locate the question area where you can type in. Some of us have already done so. If you see a little red box with an arrow in it, you could click on that to open it, and it should say questions or chat. So go ahead and write to us if you have questions or any concerns or thoughts at this time.
Okay, and while you're thinking about some of those questions, we can move on to the next slide. And that's, of course, our contact information. We just have one DSM email that gets triaged and sorted, and then, of course, you know, our direct phone numbers. So whenever you have a question, feel free to email or call. That the updates to the training guide is what's coming up next, and you know, we look to get that sent out here soon. So let us know if there are any other things that you see in Harmony or you experience in Harmony that might that we could take a look at from our end that might help make things easier or simpler from your end. So,
couple questions coming in. When submitting the LTC ADN PASRR, let's get them.
The LTC and PASRR, maybe?
And PASRR. What do we put if there is no answer or response needed instead of NA?
There will be some sections that an NA would be appropriate. It just wouldn't be appropriate for all. So it's not that you shouldn't use NA at all. It's just some sections you may see that be returned to you because it says NA when there should be a response.
Okay. Next question says, okay, so, should we pursue access to Harmony? Should we pursue access to Harmony, I guess, if you don't already, and are we able to submit for AWD retroactively?
So none of the hospitals, I should say some of the hospitals don't have access to Harmony now, and that's intentional. We were looking at allowing hospitals like Regional and Prov. The hospital would have access to Harmony for two different reasons. You might be sending us administrative wait day requests, and you'd also be sending us GR applications. And because we haven't quite worked out all the details with the GR side, as well as some long-term care aspects of that body of work, we haven't started to allow hospitals in just yet. But it is something we are working on, actively working on now. We want to start to have hospitals submit administrative wait day requests to us. So coming soon, Tara, coming soon.
Okay. Next is a comment. Okay, so we now need to submit admission orders when we submit the PASRR. The nursing homes are wanting us to use their order sets, so we might have to have the MD fill in someone else's order sets.
So just to be clear, we don't need a doctor's order for a PASRR. the PASRR just needs to be signed. What we're looking for doctor's orders for would be your long-term care authorization form. We've had mixed responses in the past where some facilities felt like, finding the doctor, is challenging enough. Couldn't we just submit documentation? So we made for that process, and we've allowed for that. We're just continuing to see both. We still see those authorizations come in signed, and we're not returning them. We're not rejecting them, I should say. We continue to accept them, and we are continuing to look for that information in the documentation that's sent with the authorization. So we may, if we don't see it, is really when we're questioning it. If we don't get an actual, templated order from the facility, we're looking, we receive that, and we're looking for additional information to that, because some of those orders don't provide specifics about what continues to require nursing oversight or monitoring or any specific orders of that sort.
Okay. A few of us have asked if we can have a copy of the presentation, and yes, we'll send you a copy in the email after the session. We'll also send you a link to our YouTube channel so you yourself or your colleagues could view the presentation. Any other questions or concerns? Go ahead and use the question box and type them in.
Anything else, Katie?
Anything else from our presenters? Okay. Okay.
I have just 3 comments to make of things that I run into as the nurse when I'm reviewing the initials. One of them is, if you could try to match the requested period of coverage with the certification by the doctor, very often it'll come in and they'll say that you want 3 months. And then I go to the certification and the doctor certifies it for a month. So I'm going to give you a month because that's what the doctor has certified. Whereas if you can match those, so be aware of that. I know sometimes you're reusing the forms maybe, and you're not always like changing it. So just be aware of that. Secondly, on the PASRRs, one of the most common things I see is dementia and intellectual disability as a categorical determination, dementia with intellectual disability or related condition. And the person does not have an intellectual disability, which probably most of you know by now is, the old term is mental retardation. So if that's not the correct one, if the person has a mental illness, say depression, and they also have dementia, it's on the bottom of page 1. It'll say dementia with a mental illness. So that's the one you want to choose, not the one on page 2. And then third, we always need a decision maker. So you'll sometimes put the person as their own decision maker, and then we come down to cognition and it's all marked problems. And so we have to go back to you and say, well, who's the decision maker? So always be sure that you have a clear decision maker on the form. If the person has, and if you give us everything's marked fine, and then all you give us is an H&P that shows the person came in with altered mental status, we're going to ask you again, give us an updated progress note to show us that they have cleared up. So those are the 3 things that I run into a lot. Scott, do you have anything that you've run into recently?
Probably that last one. I think that was what I feel I see the most often.
The decision maker?
Yeah.
Yeah.
Okay. Any other thoughts or comments into our question box there? Okay, this is Kara. I don't see any other questions coming in. We'll go ahead and close our session for today. You can go ahead and click out whenever you're ready, and you will see me end the session. Look for my email, and if you think of any questions after the fact, you can always reply to my email, and I'll forward them to Molly so that we have a complete collection of your thoughts. And that's our session for today. So thanks, everybody, for being part of it, and we hope to see you again at our next update session. Goodbye for now.